Thank you, dear. Health and Human Service will come to order. Madam Clerk?
Commissioner Baker McCormick,
Here.
Commissioner Marecki,
Here.
Commissioner Anderson has requested an excuse. Commissioner Colleen.
Here.
Chair Scott,
Present.
you have a quorum present.
Thank you. Okay, the next is my remarks. I'm just a little bit concerned about what's happening here. So when the doctor comes up, I'll ask them about what's happening with these vegetables and stuff. I know that we have this food truck and stuff. I just want to make sure that we're enlightening all of these people because they may not all be watching TV. Okay. Next item, please.
C, approve of the June 23rd, 2026 meeting minutes.
Move approval, Madam Chair.
Okay. Moved by Commissioner Colleen and supported by Commissioner Marecki. All in favor?
Aye.
All in favor, approved. Next item, please.
D, unfinished business. There is none listed.
Okay.
Moving to item 1 under new business, revision of resolution 2026-191 and 24-month comparable source contract with 1 2-year option to renew with Hydra Health.
Okay.
Good afternoon, everyone.
Good afternoon.
Good afternoon. So this resolution revision is requested. It's a technical correction to the well-weighing funding line associated with the Hygera contract that was already previously brought to you all and approved. We're just correcting the line item that that's associated with the funding for this contract.
Right. Okay, thank you.
Move approval of this item, Madam Chair.
It's been moved by Commissioner Colleen, supported by Commissioner Marecki. All in favor?
Aye.
Okay, motion carried.
Thank you.
Next item, please.
Item 2, requesting commission approval of amendment 3 to a 5-year comparable source contract with 2 1-year options to renew with eClinical Works LLC to continue providing software license application hosting services for the electronic medical record system utilized by the federally qualified health centers, also known as the Wayne County Healthy Communities and the Department of Health, Human and Veteran Services, Public Health, and Clinical Care Divisions clinics.
All right, thank you.
Good afternoon.
Good afternoon.
I'm with
Yeah. And give your name.
There we go. Good afternoon, Sammy Shelby, Clinical Care Services.
Your
so-
name again?
Sammy Shelby.
Okay, thank
Yes.
you.
So this contract is a renewal, a no-cost extension for 2 years that we're using based on our contract savings. We do have an RFP plan that we hope to release within the next few months as we are expanding the services that we have within the public health clinic and public health as in general. So we are looking to procure something that can serve our growing needs.
Okay. Any
Uh,
questions? And Commissioner Peterson Mayberry has joined us. Okay,
Madam Chair, I'll move this item for approval.
okay, moved by Commissioner same commissioners are doing it. Okay. Okay. All right, Commissioner Colleen and Marecki, all in favor? All right.
Thank you.
Okay, motion carried. Next item, please.
Item 3, requesting commission approval of a 1-year clinical outpatient service provider agreement with 2 1-year options to renew at the sole option of the Detroit Wayne Integrated Health Network to support the provision of mental health services for the Wayne County Jail adult inmates.
Good afternoon, through the chair, Ebony McCann, Division Director, Health, Human Veteran Services, Transition Services. Before you is a request to enter into an agreement with Detroit Wayne Integrated Health Network for the sole provision of providing mental health services for our male and female inmates at the Wayne County Jail. Each year, DWIN provides the county with $5 million that money is then used to provide mental health services for inmates who have been assessed and or diagnosed by a clinician at the Wayne County Jail with a mental health impairment. Services include psychiatric evaluations, medication, management services, and other behavioral health impairments that an individual may have while under our care.
Very good. Thank you, Ebony. Any questions of Ebony? Commissioner Kleen?
Thank you, Madam Chair. Was this a provision that went all the way back to the enabling resolution? Was it in that, you know, when they separated it from the county to a freestanding authority 12 years ago? Did we provide in there for this 5 million for mental health care in the jails?
I'm not sure of the historical context of this agreement. I just know that since since I've been here at the county, we've annually received funding from DWIN. I can research and see what actually triggered them providing the
Pretty
services.
sure that's how it went
Okay,
when we separated, just to make sure to keep the county for the mental health services
Involved.
in the jail. That there was a provision for that the county would send this money to the DWIN to cover those costs. Okay, thank you.
DWIN is actually sending the county the
Right.
money.
Well, that's what I mean. We
Yeah.
send it to the county,
Yeah.
so the county can provide the
Yeah.
services. Oh, well, I'm easily confused, but yeah, that was the deal. Okay,
Okay.
thanks.
Yeah.
All right. Thank you, Ebony. Commissioner Marecki?
Thank you, Madam Chair. And actually, through the chair to our legal group, could you explain? So the department perform unauthorized services worth at least over $3 million
Oh,
in violation of the charter.
so this is again, one of those contracts where the timeliness and just getting it processed, services had to continue. So that's the amount, I think, of the estimated services at the time that was written. But it's just a matter of in the future, just trying to be more timely with regards to processing the amendments.
Okay.
And just if I may, for the sake of this discussion, the delay of the processing of this contract is in part is twofold. So our juvenile youth services has a contract as well, but we can't take action and bring the contract to your attention until DWIN actually produces a board action. That board action typically, or that meeting usually takes place at the end of the year. And then we receive the board action at the beginning of the following year. And so DWIN met around Christmas time. The county operations were not open during that time. And so we received an actual board action from DWIN January, February. There were some extensive contract negotiations that took place. We actually received a contract from DWIN. It was a renewal. Originally, we were clear to move forward with the processing of the renewal. And at the last minute, DWIN decided that they wanted to enter into an actual agreement. And so we had to remove the renewal and then present to you a full contract. And so that's the cause of the delay.
Okay. All right. Thank
All
you.
right. Thank you, Ebony.
No worries.
Always so well informed.
Yeah.
Wow. Okay. Anyone else? Hearing none, a motion, please.
Yeah, Madam Chair, I'll move this item for approval.
All right. Commissioner Kleen moves. Commissioner Marecki supports.
Thank you.
And I am in favor, so all three of us are in favor of it. Okay, motion carried. Next item,
Item 4, discussion with Bridgeway Services, CCMO Center for Youth and Families, and Vista Maria DBA Insight Youth and Family Connections.
okay? Are they here? All right. Thank you. State your names, please.
Tawana Reese with Vista Maria doing business.
You get to put the mic on,
I'm
please.
sorry. Tawana Reese with Vista Maria doing business as Inside Youth and Family Connections.
Jerry Fisher, Center for Youth and Families.
Amy Reband, Director at Bridgeway Services.
All right. Thank you. Who wants to start?
I can start.
Okay.
Insight has been part of the care management organization since early 2000s, and can you hear
Pull
me?
that up just a little bit more.
Oh, it moved.
please.
I didn't know it moved. Okay.
Yes.
Our zip code areas are within Northwest Detroit. We have 7 zip codes and 2 zip codes in Dearborn Heights. Um, we have a few programs that are in-house that focus on keeping the youth connected to their education and community and families. One of our programs is our Check and Connect program, which is focused on education. Every young person that has challenges in those areas with their whether it be severe attendance issues or behaviors in school or any type of academic challenges, you're assigned an education specialist that works with you to mitigate those barriers and put some interventions in place to help them be successful in school. Then we also have our STEPS program, which is our after-school programming, and also our prevention programs also fall under this, where we have individual and group counseling that focus on life skills and workforce development. Right now, we're really focused during the summer on the Grow Detroit Youth Talent. Young people that are in that program, they go on field trips, they work on workforce development groups and workforce readiness type of skills. So those groups are every day from 10 to 2 within our building. And I'm forgetting the third program. And our Respect Ed program, which is through a federal grant for us to administer the Love Notes curriculum, which is really focused on healthy relationships. So we have a cohort for 6 weeks, and the goal is to serve 548 youth over the 5 years, where they'll participate in this cohort every 6 weeks, and the focus is healthy relationships and sustaining those relationships.
Very
Mhm.
good. Okay.
I guess I'll go next.
Okay.
Center for Youth and Families is located in the New Center area. And we're kind of like that wedge between the east side and the far west side. So we service kind of the near west side and the near east side, including Hamtramck and Highland Park. Um, we've been in service since 1999. Our partners are Spectrum Human Services and a Center for Children, which gives us a nice balance with the child welfare and in keeping us focused on families and children. Um, our main guidelines or the kind of the 3 principles that we follow is to do justice and to ensure that justice is done not only with our children, our parents, but also with our staff, to treat them justly. The second is to be merciful, and that kind of guides our prevention programming and providing mercy to people. I'm sure glad there's been a lot of mercy extended in my youth, and we want to continue to extend that mercy to others. And then humility. I believe not only in cultural humility, but I also believe in generational humility, and that just because I may have one child that is a millennial doesn't mean I understand all millennials. Or because I have grandsons that are Gen Z doesn't mean I understand Gen Z. But if I go in with the attitude of, I want to learn more from you, I want you to teach us how it is. And I think it's the same. I'm a Detroit resident, or not currently, but I grew up in Detroit, was born, raised, went to school, go Huskies, and continued. I then raised my child in Detroit, but my experience as a white woman in Detroit does not equal the experience of a Black woman in Detroit or, a family Black family or Hispanic family in Detroit. And so it's having that humility that just because I may have an experience that is similar doesn't mean I totally understand that. And that goes with our children as well. I understand rebellious children. I was one. But that doesn't mean that I understand the ones that we serve today. And the ones that we served in 1999 and 2000, 2005 are very different than the ones that we are serving now in 2026. And so that's our frame. We also use 3 evidence-based models. We use wraparound, and we have full certification for wraparound. We use TBRI, which is a trauma-informed model that is used with those in juvenile justice placements. And then we also use, and I'm just now, I got a blank going. Oh, how could I forget? Restorative justice. And all of those 3 models really do complement each other. They're all strengths-based. They all are trauma-informed. They all come from a perspective of we want to first not ask, okay, what did the child do? Which is so often the question in juvenile justice. But we want to ask the question of what happened to this child. I've never met a sex offender, juvenile sex offender, that wasn't first abused themselves. I've never met someone who has gotten into, violent lifestyle that wasn't treated violently first. And so we want to be able to address those root causes of what is happening with them. We do that through the CMO, and we do that through prevention that is our YAP program, but then also we have our own self-funded programs because we believe that we are required to make this difference in our communities. And so we have a girls resilience group that has a core hope group of 12, and it continuously runs every 12 weeks. And we wanted to focus on girls just because we kind of like girls better than boys. No, they have very unique needs. We also have a boys program that focuses really on gun violence and also how to make better choices, and what does it mean to grow up to be a man and what would be expected of them as men. And we also do our backpacks. We do yearly backpacks. In the summer, we do food trucks where we go to different areas where we believe there's food insecurity. And we partner with someone within that community, whether it's a church, a mosque, just a community group that is working, a neighborhood association. And they plan an event, and we partner with them with the food trucks. So this way, everything that we try to do in partnership. There isn't anything that Center for Youth and Families does alone. And that is, I think, part of our DNA. And we pass out anywhere between 1,000 and 1,200 meals during the summer. During the Christmas, we pass out meals. We make sure every single one of our kids has a Christmas gift. It would break my heart if I knew one of my kids did not have a Christmas gift. We also do the coat and jacket giveaway in the fall. I don't want to see a kid walk into school in a hoodie. They should have a jacket. And so it's some of those kind of just principal things that we provide for them, but also then we provide for their basic needs. We provide for their emotional needs, and we make sure that they have also people in their lives that can speak to them about whatever faith they have and can support them and can use that faith in a way to help them develop their own ideals of faith. And so that's kind of a summary of what we do.
That's great. Thank you. Next.
So I'm here to speak about Bridgeway CMO, of which I am the director, and Bridgeway is a unique partnership. So when the CMOs were formed back in 1999, we were formed by a partnership with the Guidance Center and then what was Southwest Solutions. Southwest Solutions has merged with development centers and they are now called MySide. So we are a unique partnership of those three entities, our Bridgeway office, our partners at the Guidance Center, and our partners at MySide. Big picture, the Guidance Center and MySide are both community, let me see if I can get this right, certified community behavioral health centers. So they provide mental health and substance abuse treatment to a wide range of people and including even those that are uninsured. So through that continuum, we can really connect our youth and families to a wide variety of services. And I'm sure you know about a lot of the programs being provided by the Guidance Center and MySide. If you want more information, I can certainly connect you, but a couple things I wanted to highlight about each of them today. Guidance Center has the Kids Talk CAC program, which is a child advocacy center, which is very important here in Wayne County. And then MySide has a program with a lot of strong success called Detroit Youth Grow, which they use for justice and at-risk youth. And it's an earn and learn program that helps provide the youth with job skills and life skills to prepare them for their futures. Separate from this CMO contract that we have, both of those partners have youth assistance program contracts with the county. And then both of those entities also have programs for MST, which is multi-systemic therapy. That's an evidence-based program shown to be really effective with at-risk youth and in keeping them at home and in their communities and addressing the problematic issues that have brought them to the attention of various systems. So the Bridgeway office is the contract holder and serves a lot of the administrative functions, and then the case management functions are served by our partners at MySide and Guidance Center. Our catchment area is the zip codes in Southwest Detroit and all of the downriver communities. We have 19 zip codes assigned to us per our contract. Those primarily fall in districts 4, 14, and 15. So you've already heard from my colleagues a lot about what some of the case management looks like, and I think there's a lot of pieces of it that you know. It's visits with schools, it's case notes, it's communication with courts, but I think there's a lot of invisible work that happens, and Jerry spoke to some of that immediately before me about building relationships with youth and families, constant crisis and risk management, service coordination to get them into whatever services they may need to be successful. There's a lot of advocacy that happens from the case managers, especially with education environments, public schools, charter schools, whatever that might be for the youth in our care. And a lot of supports and assistance provided related to from everything from clothing to food, to housing, to transportation, all of those things to try to get success for our youth and for our families. Brought a few details about the kids we served last year, and I will leave packets behind so you can have all this information. So last year, Bridgeway served 178 youth. Majority of those were male. 91% of the cases assigned to us during last year were for community care and supervision. Those in the community had an approximate length of stay of about 350 days, so around 1 year before they were discharged. Most of the referrals came from either Taylor, Lincoln Park, or zip code 48204 out of Detroit. The majority of offenses when they were referred to us were assault and battery, domestic violence, CSC 4, and felonious assault. 88% of those had severe emotional disturbance, which means they may had some sort of mental health condition that was impacting their level of function. Of those, 78% were connected to and receiving services. The MST program I spoke about earlier, that multi-systemic therapy program that our partners have, we had 10 youth complete that program. And during the course of their treatment, they were able to stay at home, in school, and with no new charges. All of the CMOs were built on the idea to try to keep kids at home or in the community as much as possible, keep them out of residential placement, and our success and our data reflects that. Over the last 3 years, we have had 10% or less of our population escalated from the community to a residential program. And last year, those youth that were terminated from care, 96% had no additional felony convictions, and 92 were considered successful upon their termination. So I've been in and around this system for almost its entirety in various capacities, and I am proud to see the innovation and collaboration that has led to all this, and I look forward to continued partnership and where we go, what the next steps are in youth justice.
Very good. Thank all three of you. Is there any questions? Okay. Commissioner Kling, Commissioner Marecki, and then Commissioner Mayberry.
Thank you, Madam Chair. And thank you. We've had a whole series of folks coming before us and better understand what's going on out there with the CMOs. Now, all of you get YAP, Youth Assistant Program funding through the county?
Insight has a YAP program.
Bridgeway does not. Bridgeway does not have a contract for YAP. Our partners have separate contracts
Oh, okay.
for that.
Because we just went through all of our youth assistant programs. We had to amend the contracts for them because the Michigan Child Care Fund changed the ages. So I want to check with you guys since you're on the ground. And I don't know if you get other funding that involves the, you don't get any funding that involves the Child Care Fund, but has that affected those age changes in the funding through the Child Care Fund? Has that affected your services or anything like that on the ground?
So far, I have not seen an impact.
No, and I think the
Okay.
reason being residential is licensed age 10
Oh,
or
okay.
yeah.
Because I always want to check in and see. We get the contracts up here. How is it affecting actual? So you have limitations due to funding for how many kids you can have in your program. But can you kind of estimate that if funding was as much as you want, how many kids are we missing in your catchment areas that could really use your services? Are we reaching half of the kids, more than half of the kids?
So our funding is really based per youth assigned to us and their level of care. So it's driven by that. However, we, I think, have all seen over the last few years a decrease in the number of youth on formal probation. I think it would be useful to know, the intent of juvenile justice reform was to divert as many kids as possible and to have a larger system picture to know how many youth are in those diversion programs. Those are numbers I don't think we have, but is this being successful and are those kids being diverted? Or are there kids out there without services?
Yeah, and do we have a sense of how many kids are out there without services that need services in your areas?
I think also, Tim, looking at it on the financial impact of the CMO, and you all know I've been around too long. Once when Martha retires, I retire. We are this year going to lose a little bit over $1 million.
Does the state legislature need to act on this as far as funding goes? Because it's a shame. We have these successful programs and they've been proven for youth, right? And so not to be able to be, because there's so many costs to society of kids that do not get the services that you have to offer. So, sometimes people just look at the dollars going in, but don't look at what all the other costs are for not properly funding these. So Does the legislature need to act? Are you talking with the legislature about increasing funding?
We've not talked with the legislator, but I will say Wayne County and the department is well aware of our loss. And I'm sure there's many factors that go into that, including, rules and structures the state puts into it, what
Right.
they can and cannot do, So I think it's, for this year, we can survive, but we can't continue. So there needs to be a different structure. And I think a lot of that is because of the limitations the state is placing on the county.
And that's administrative decisions by MDHHS rather than decisions made by the legislature.
Yes,
And we're going to get a new MDHHS director here
right,
in the near future,
correct. Yes.
apparently.
The interim one is from finance.
Say again.
The interim director is from the finance.
Well, that's not good
Division.
news.
No.
Um, and do you participate at all? Does the governor's office reach out to you about appointments like this and have a discussion about folks on the ground and what do you need and what do you need out of MDHHS when they're looking at a new director? You're not part of any discussions?
No.
It seems like despite how long the CMOs and this framework has been in place in Wayne County, a long time now, that the state is not very aware of the work that we do here and how successful this framework has been. Although I did hear
But you submit copious reports to them.
we submit them to internally to the county,
Oh, to hear.
right?
Okay. Yeah, it's a shame that these things, and just the way government is funded, right? That these decisions with proven programs come down to dollars and cents and don't get the funding that they really need and can really have a bigger impact in our neighborhoods and our local communities than they do. So even more reason to thank you guys for all the work you're doing out there with our youth and the pennies that we shovel at you to continue that work. So, okay, but I'm always open to discussions about funding and the lack of funding and what we can do there. If not straight up in the budget, but other ways of getting dollars to these local programs. Because these kids are with us for a long, long time in our communities. So, well, thank you for being here. Thank you, Madam Chair.
Yes, thank you. Do you talk to any of the legislators that's in your areas about some of these things?
I meet with our legislatures about once a quarter. I also meet with Representative Santana, who is a big advocate of juvenile justice.
Right, she
Uh,
is.
Yeah, so I have a regular meeting with her as well. But with my local ones, at least once a quarter.
Okay. All right, thank you. Commissioner Marecki?
Madam Chair, I'm just wondering how many case managers each of you have and how many cases each case manager has.
So Insight has 8 case managers and we try, because of the needs of the kids, we try to keep our caseloads within around 10 to give them the opportunity to, address the challenges and the kids that we have today are a lot more challenging than they have been in the past. So it allows them to have some quality visit and be able to intervene appropriately without having a high caseload. So we try to have a caseload of about 10.
10 and you have 8.
Mhm.
Okay.
Right now we have 7 case managers. In the community, they have a caseload of 10. In residential, we just moved to where they have a caseload of 15 because we wanted to add additional visits and some additional services to the residential youth.
We have 8 case managers, and the last fiscal year, our ratio of case managers to youth was 1 case manager to 9 youth.
Tonight, are all these case managers in your own, do you have like any third party groups that are like part of your case managers? Or is it all in your,
So for me, our case managers are employed through the guidance center on my side because that's how we are structured as a CMO organization.
Mine with Innocent Spectrum, it's a contractual basis. So while they're part of it, we can also still hold them to the standards.
so they have all the case managers?
No, they have the community, we have the residential.
Oh, got it. Okay. All right.
And all of our case managers are employed by Vista Maria.
Okay.
Mhm.
All right. Thank you.
All right, thank you. Commissioner Mayberry?
Thank you, Madam Chair. Through the chair, what metrics are you using to gauge the efficacy of the programs? Is it like around academics and how they're doing back in school? Or is it something else internally that you're doing, like now during the summer, school's not in? But what are those key metrics that you're using to see how effective the programs are? Because we know that they are, but data is everything, so.
So for each of our programs, like for our Check and Connect program, we're looking to see how many youth have advanced or improved grades. Attendance has improved. We have kids who are disenrolled, so we're looking at how many re-enrollments we're able to accomplish within that school year. And then our after-school programming, we're looking at just participation alone and the family engagement piece, making sure that the families are engaged. So we do calculate how many families are engaged in our monthly case conferences because it predicts the success at the end. And and then obviously the county has its own metrics of kids who are successful at the end of probation that are not AWOL at the end of probation or not have attained an adult charge.
Okay,
So
okay, thank you.
I
Ms.
think
Jerry?
the same. The one that we look at the most overall for a big picture is our AWOL rate. Because that really does show us, are we connecting with the youth? Are the case managers have a relationship with them? Are they, progressing? Or even if they're not progressing, at least they're still talking. And so that's one of them that we look at on a weekly basis.
Same answers. You've already heard a lot of things related to recidivism and additional crimes, AWOL. We also look closely at youth being enrolled and connected to community mental health or other similar services because it seems to be an engagement of what they can do once, if they're in those services, once they're no longer on probation oversight, things we would like for them to continue or resources we would like them to know exist.
And thank you. One last comment through the chair. I don't know if we are taking advantage of youth who go through a program like this and then they have transformed their lives and now they become advocates for the program to youth because they're closer in age to them. Their journeys are oftentimes very similar, but what is that aha moment for youth who are going to try to prevent other youth from going down that same road? And I don't know if we've taken advantage of youth in this space, but it might be something worth looking into to find out who the ambassadors can be, because we're a bit removed from the youthful age, at heart for sure. They're there, but oftentimes that resonates more closely when they have someone closer in age. So thank you, Madam Chair.
No, thank you.
thank you.
Okay. None other questions in that? Well, thank you all for coming.
Thank you.
And I do see a Black Family Development person in the audience. And so I was wondering if you have anything to add to this today. Because I go over there monthly to their meetings. And I do know that they had a fantastic program with the young men over there. And he kind of leads it. Oh, and GrowthWorks is always here. We thank you for that. Do you have anything else to say? No? Okay, all right. We will make sure that everyone has an opportunity to come and give us information on their organizations. All right, thank you. Okay. All right, thank you. And next item, please.
F, such other matters as may be properly submitted before the committee.
I don't know of any. Next item.
G, public comments.
Is there anyone online?
There's no one on Zoom indicating that they would like to speak.
Is there anyone in the audience? Okay, the doctor wants to say something. Because I wanted her to say something about this food today too.
Yes. So Keneal Johnson, Director of the Department of Health, Human and Veteran Services. And Madam Chair, I'm so sorry to disappoint you, but I am not a doctor. I wish I was.
Okay.
My husband
right.
is, our
Okay.
Chief Medical Officer
Okay,
is,
all
but
right.
I
Chief
live
Medical
vicariously through
Officer.
them. And, you know, I accept all, yes, I accept it.
Okay.
Before I get to the food outbreak, I do want to just ask, on the agenda for item 1, when we asked for the revision to the resolution, we noticed that the Wayne Cost Center description on the agenda still says Highland Park Equitable. And the revision is requesting for that description to be changed to Wayne Community Behavioral Health. And so I just want to make sure that that is noted. So
Yes,
it's done.
It
Okay.
is.
Okay. Thank you
We'll
very
make
much.
that change.
Okay. Thank you, ma'am. Thank you.
Thank you.
So, as you all know, Dr. Chef, she is our Chief Medical Officer for Wayne County, and so she is out of the office this week. It seems like every time Dr. Chef goes out of the office, we have an outbreak, but she does a phenomenal job staying in contact with the state and then updating me and the team accordingly. And so, as we all know, we're dealing with a recent outbreak of the cyclosporosis, yes, illness that comes from a cyclospora parasite. Right now, the numbers in Michigan, they continue to grow. We started out with like 160, and now today we are nearly 700 and still growing. The counties that are most impacted are Monroe, Lenawee, Washtenaw, and Wayne County. I will tell you that I did receive an update today from Dr. Chef. In Out County, we are up to 75 cases. Detroit does have only 6 cases. The parasite has been linked to fresh produce, and so we are encouraging everyone to make sure that they wash their hands, wash the produce. Previous outbreaks have been associated with consumption of bagged lettuce, the bagged salad mixes, fresh cilantro and basil, raspberries, snow peas, and green onions. And these were produce that were associated with previous outbreaks. The state has not identified the source of this recent outbreak that we're experiencing, but we are gathering information from as many people that we can that has reported feeling the symptoms and trying to get down to the bottom of what is the source of the contamination.
Okay, they're saying don't use the bag lettuce at all.
Right. If you want a salad, we are encouraging everyone to just buy the head of lettuce,
Right.
peel back the first out, the outer layers, and then wash it really good and then cut it up. The symptoms are typically diarrhea, nausea, fatigue, but the most common symptom that we are seeing is diarrhea. And the symptoms can start anywhere as early as 2 days after exposure or a week. And so if you or anyone you know has those symptoms, we are encouraging you to contact your healthcare provider. They will do a stool test to confirm if you are positive for the parasite. And then if you do have it, then they will treat it with a antibiotic. Bactrim is the antibiotic that they're treating with, and that's a common effective antibiotic.
Okay. Commissioner Mareki.
Thank you. Wayne County just put something on Facebook that's really good. Did you?
Yes.
Yeah, I think it's a really good informational. So I've been sending that around to people.
Thank you for bringing that up.
Yeah,
Yes.
it's real concise, and thanks for doing that because we can all put that on our pages as well.
Yes, no, I appreciate that because interestingly enough, I got a text last week because we were one of the first to communicate on social media information about this. And I did get a text that someone was in Oakland County and they were just giving kudos to Wayne County for sharing information. So they were informed and they said, well, because of Wayne County, we know that we have to wash our produce really good. And so they got the information about this. So thank you for sharing that.
Yeah,
Yeah.
no, it's a great setup. You know, the graphics are real good too.
Good. Our comms team will be very happy to hear that. Yeah. I know that, some of you may be aware that we are rolling out the fresh trucks that was previously
Right.
approved here. And so that launch, we've been doing a soft launch throughout certain communities. And tomorrow is the official launch. It's taking place in Dearborn at Senior Center. And I cannot think of the name of it, but it is a Senior Center in Dearborn tomorrow where the official launch will be taking place. I will say that the produce that the Eastern Market is bringing to the communities and making available for purchase is sourced by local farmers. And so we're not concerned with the produce that will be distributed through the fresh truck being contaminated, because like I said, that is sourced by local farmers.
That's what I was concerned.
Yes, yes.
Okay,
Yeah.
all right. Thank you. Commissioner Marecki.
Thanks. I think I asked this about something a couple years ago, but do you guys at those fresh trucks give out any kind of recipes to people?
Yes.
Okay.
And so we are actually going to be partnering with our current partners, MSUE.
Okay.
And also we're looking to partner with Blue Cross Blue Shield and possibly doing cooking demonstrations and then providing recipe cards. And at Eastern Market, they also do recipe cards too, but we're looking to make it a little bit more expansive through the partnership with MSUE and doing some cooking demos and recipe cards for individuals, because sometimes people need some tips on what they can do with all that good food.
Definitely. Yeah, definitely.
Yeah.
All right. Thank you.
You're welcome.
All right. Yes, Commissioner.
You use the shorthand, Madam Director. Michigan State University Cooperative Extension
Yeah.
is the
Yeah.
way most
I
people
think that's what she meant. when
hear
she said
about it.
MS.
Yes.
So I just wanted
Michigan, yes, thank you.
I just wanted to underscore that. They do
Oh,
wonderful
okay.
work in the county.
They do phenomenal work, and we're so grateful for their partnership.
Yeah.
Yes.
Thank you.
Thank you, madam.
All right.
All right.
Thank you.
Thank
Uh,
you.
Appreciate that.
Okay.
Anyone in the audience would like to say something? Anyone in the audience?
Madam Chair, we do have a public comment on Zoom.
Oh, okay. Would you?
Lauren Stovall.
Yes. Thank you. Go ahead, please.
Okay, yep, I was just able to unmute. And so good afternoon. My name is Lauren Stovall, and thank you for the opportunity just to speak. I think what I would love to do is just to do an introduction. I am a certified prevention specialist for about 11 years or so, working with the National Council on Alcoholism and Drug Dependence. I actually heard a few persons that organizations and agencies that we partner with share. And my objective today was just to hop on and do an introduction. Some of you all may not be familiar with our agency and the work that we do. I do work on the prevention side, but for well over 60 years, NCADD for short, has worked to strengthen individuals, families, and communities through prevention services, treatment services, and recovery services throughout Wayne County. And so, I think as an introduction, I just wanted to share the work that we do, as well as open it up for opportunity to partner more with Wayne County. I think partnership could look like expanding just prevention education, strengthening family support through the resources that we provide, increasing youth engagement, and just have an opportunity to collaborate with county departments. One of the things that we're focused on in our agency, and me particularly being on the prevention side, is we're introducing something that is called prevention pathways. What this allows us to do is, even within our own agency, is to not work in silos. We tend to have different departments and even programs, and sometimes we get caught up in working in silos. And even as agencies, we do so much similar work, right? I heard some of again, the other agencies and organizations doing such great work, and we all do kind of similar things throughout the city or the county, I'll say. And we want to really incorporate a pathway that allows us to work together. And so within our agency, we're doing a framework called Prevention Pathways, which connects media and digital prevention, community and faith partnerships, parent and family support, as well as youth voice and empowerment. I think one of the commissioners talk about ambassadors with the youth. We are focused on that as well. And so I'll stop there. I just wanted to introduce myself again, Lauren Stovall, and working with as a certified prevention specialist with NCADD. One of our big initiatives, I'll say this, is April, which is Alcohol Awareness Month. So our agency founded that that month of April, which is now nationally recognized as Alcohol Awareness Month. And so we do a lot of programming in the schools throughout the community around alcohol awareness, particularly in the month of April. We also have Recovery Month in September coming up, where we do an annual walk and rally on Belle Isle in the city of Detroit. And so those are just a couple initiatives that we do. We partner with the Center for Urban Youth and Families through our coalition work. And we do a community back to school rally, which is coming up here in August. So I just wanted to, again, say hello, introduce our agency to you all. Thank you for the work that you all do as commissioners here. And I hope to have an opportunity to speak more with you all and hopefully connect some dots and work together in this work. Thank you.
Thank you. Pardon. Well, no, the Commissioner Bell and I both serve on National Council on Alcoholism. I've been there before Dr. Jones became the director. When he was a staff person, I was a commissioner many years ago.
So let me say this, forgive me, I can't see, nor do I have a list of who is in the room right there and who is sitting on that commissioner board. So then
I am Commissioner Martha G. Scott.
Yeah, so I've been working with the agency for, again, about 11 years. I'm familiar with you.
Yes.
And Commissioner Bell,
yes.
I'm familiar with her as well. So, but, you know, apologies that I don't have a clear view right now of who is in the room and who's speaking. But so thank you. So please consider, you know, the work that we do at NCADD. I think we could do a better job of working with you all, just with the county in totality.
Thank you. All right. Anyone else?
That was all via Zoom.
Okay, next item.
Adjournment.